Heat or ice? So let's talk a little bit about which one is better and when it's better to use each one. My name is Brian Mulligan. I'm the owner of Mulligan Physical Therapy. I've been doing PT over 25 years. So I wanted to share a little bit of input on what happens when we use heat or ice and when should those two modalities be used more often. So just in general, what does ice do? Well, ice is what we call a vasoconstrictor. So what that fancy term means is it just decreases blood flow. So anytime you have ice on an area, it's going to decrease the amount of blood flowing to that area. So in general, and most historically, we've been using ice to help with decreasing swelling. When you have an injury and there's a lot of swelling initially, there's a lot of blood flow to that area. So we're trying to constrict that to get that blood flow to get out of that area to help with the healing and the tissue regeneration. Heat, on the other hand, is called a vasodilator, meaning, again, that the vessels now, the blood flow increases, sending more blood flow to that area. And that's by nature what's happening when you have heat on an area. So in general, with those, you don't want to really put more blood flow into an area when there is an initial injury. You want to use it more for things like helping calm muscles down, muscle tension, tightness, those type of things. So in both cases, they can be very helpful. And what I find is a lot of times patients are asking me all the time, which one do I use? When do I use heat? When do I use ice? A lot of times for me personally, when patients are here, we will do a lot of heat in the beginning to loosen things up as we're trying to stretch things out, depending on whether it's a muscle tension, whether it's joint stiffness, general pain. And I find that a lot of times those do help improve circulation and help us be able to get things moving a little bit quicker in the session. Now, I try to be pretty proactive as far as not just letting them sit on heat or ice for any length of time while we're trying to get things moving. So a lot of times, especially for my back patients, I'll have them lay on the heat for just a few minutes till it starts to get warm. And then we'll start actually doing a lot of the stretching. I'll have them do stretching and then I'll do the stretching with them. And I find that a lot of the patients respond pretty well because they feel like their back is relaxed on the heat while we're doing some of those things. So in general, if you have an initial injury, you sprain your ankle, you land wrong on your arm, you fall on your hip and you're bruised. Again, generally with that, we want to decrease the swelling there by decreasing the circulation to the area. So ice is going to be pretty much the no-brainer going to that. When you have a chronic condition, however, that really changes the game a lot. And what I found in my career is that a lot of times, I'd be recommending ice for somebody and all of a sudden you find out, I just don't really like ice. I don't like being cold. It just doesn't react well to me. I prefer the heat. And in those situations, I say, okay, well, if you're getting some relief out of it, doesn't matter what the normal is, whatever's working for you is the best option. There are certain cases where we wouldn't recommend that, but in a lot of chronic cases, you have an ongoing inflammation up and down, swelling up and down constantly. It's not an initial injury. So in those cases, a lot of times what happens is using heat can be very calming to the body and to provide some pain relief, because both heat and ice are used as mild analgesics. So they're helping for pain relief in a very mild way. And with the ice, I think most people understand that it numbs the area so you don't feel the pain. With the heat, it's just helping soothe the area. It's a lot more relaxing to most people. The one condition I would definitely recommend only using heat in is if somebody has muscle spasm, muscle tension. So a lot of people will go right to, my back's hurting, it's all knotted up, it's got a lot of spasm in there, I put ice on it. Well, the general rule there is if you go outside and it's cold out, what do you normally do? You tense up and you shiver. So the same thing is happening when you put ice on an area that's already tense. You're just going to create more tension. So if you're looking for the pain relieving option of it, where it's numbing it up so you don't feel it, that's fine. There's nothing wrong with that. But in general, what I find, especially when it comes to the spine, the neck, the lower back, there's a lot of muscle tension in there generally. And if that's part of what's causing the patient's pain, then what I would go to right away would be the heat, because the heat's going to be much more relaxing to the patient. It's more soothing. It's going to decrease the muscle tension in there so it can get stretched out a lot easier. So the heat in those cases, I believe, is definitely the better option for that. But in general, they're both going to provide some type of pain relief to a mild extent. They do have their purposes. But what I would recommend is if you're using heat, people always ask also, how long do I do this for? Well, the general rule of thumb has been like 15, 20, no more than 30 minutes. You want to provide some heat, some ice. In the case with ice, it's typically going to warm up after 15 or 20 minutes anyway. So you can refreeze it, you can get another ice pack and try it again a little bit later. With the heat, it depends on what heating component you're using. So for some people, they'll use an electric heating pad, which obviously it's on as long as they keep it on. In a lot of other cases in recent years, people are using a microwavable type of heating pad where they throw it in the microwave for a few minutes and it stays warm for 15 minutes or so. And again, those cases, it's going to cool off after a little while. So that 15 to 20-minute mark still applies. What we don't want to do is we don't want to overheat or over ice anything. We want to give it that little bit of break in between. And the bigger concern with most people is if they have a sensation loss or a sensory loss. If they're putting heat on an area and they don't really feel that because they have sensory deficits, that's a concern that they could burn their skin. If their skin is fragile, it can burn their skin. So that's the other reason we don't want to have it on for hours and hours and hours. But my recommendation is if it's helping, you can definitely continue to do it. If you take a little break for 10 minutes, 15, 20 minutes, half hour, and then put it back on again, I find that the continual heat for tight muscles is very, very helpful. And in the case of swelling, it depends on the swelling. You know, if it's very localized swelling and it's not chronic in nature, the ice can do a very good job. If it's a chronic swelling, you're going beyond the ice now and possibly looking at some type of compression to get it more uniform compression and more uniform swelling reduction that way, and elevation as well, rather than just the ice. So when it comes to heat or ice, what's the best option? Honestly, it can a lot of times be up to the person who's using it and what they prefer and what they feel gives them the better relief. So it does have its purpose in certain ways and certain times, but in general, anything that you can do to help alleviate your symptoms is what you're trying to do. So I hope that helps. I hope you find out what you need to use. And if you have any other questions, let us know.